Hi, Dr. Kim Cater here from Cater Chiropractic. I'm at a conference in Santa Clara. I'm wearing these fancy clothes because I'm an associated clinical instructor for acronym methods. I've been helping people out all day. While I'm here, I met an old friend of mine I've known since 1983, Dr. Don Hayes, and I've run into him over the years. And Dr. Hayes is a co-owner and developer of some of the products called Greens First. And Greens First is a product that I've literally been taking for probably 20 plus years. And the reason why I take it is because it has basically a powder. One scoop has 54 different food groups. It helps keep my body from an inflamed state to a less inflamed state. It empowers my body with multiple phytochemicals every single day. And it's probably less than a cheap cup of coffee. It's something, and in our office, we've probably sold more of this product than any product that we've ever sold. And now I have the chance to talk to Dr. Hayes here. I have some questions for Dr. Hayes, and I thought I'd take advantage of this for our patient base. First question, Don, tell us a little bit about yourself, a little bit about your history.
Glad to, and it's great seeing you again. It's been some time. I, like you, am a chiropractor. I practiced for over 20 years. I had 4 chiropractic clinics. And during that time, I experienced all the different ups and downs of chiropractic around the world of inflammation. I had an opportunity then after 20 years to become a partner with the world's largest nutrition company at the time. I took advantage of that because nutrition was my passion and love. I did that for 7 years, and then when I left there, I actually formed our present line, Greens First. And the experience that I had there was phenomenal. We had a science officer, a chief science officer named Jeff Bland, PhD. He's considered the father of functional medicine. So not only did I learn how to develop great products, but I learned exactly what it would take to help patients really beat the inflammation problem that we see in practice on an everyday basis.
So now, what prompted me to have this discussion, you've come up with a new inflammation protocol that we definitely want to implement in our practice. Tell us how this is helpful for one's decrease in inflammation. What does that mean? How does that help one's health and well-being?
Well, it's simple. I mean, the first thing, the protocol itself is called Inflam. This is the brochure that educates the patient around it. And so in here is the explanation of and all the scientific research behind it. This is a blood test. This is a at-home finger stick, patient-administered blood test. It was developed because of the 1982 Nobel Prize in Medicine that discovered what causes chronic inflammation. You know, Kim, both you and I graduated before '82, and so they didn't even know what caused chronic inflammation. Now they know, and they know exactly how to deal with it. And for patients that have neck and back pain and joint pain, there is a chronic inflammatory component always there. But the way to measure chronic inflammation, you're an expert at measuring acute inflammation as I am, is the blood test. And this inflamed blood test is a very simple 1-drop finger stick at-home blood test that a patient can administer, mail it to the lab, the results come back to you, the doctor, and you're able to sit with them and actually go over it. And it looks something like you see here. I mean, this is the actual visual of the blood test that you'll get back. But with that information, now you'll be able to round out your treatment program, be able to deal with both the acute and chronic, and use the nutrition appropriate to correct both, get better outcomes, and that's really what patients are looking for.
I can tell you with absolute certainty that inflammation is one thing we're all going to hear more and more about, because the more inflamed you are, the less healthy you are. The more pain you have, it can affect your weight. And what I'm going to do is I'm going to go ahead and do this little test myself. I'm going to monitor where my inflammation is and how it changes on the right, perfect protocol for improving my health. And we're going to offer this to our patients. What I've discovered as well is that this is very affordable. I've stayed away from laboratory tests because of the complexity and the fact that it was always very expensive. And this is what we consider to be very helpful to patients. And we're really excited about incorporating this to our practice. So Don, thank you very much. I appreciate your time and appreciate your passion and enthusiasm for helping people.
Thank you so much. Nice seeing you.
Great, thanks.